When the brain is in crisis, stroke, or sudden bleeding, every minute can protect millions of neurons. In this video, you'll see how doctors act fast, restoring blood flow by removing a clot or relieving pressure with surgery. Let's start with why time matters. Sometimes a clot blocks blood flow to the brain. This is called an ischemic stroke. To remove this clot, doctors perform a procedure called mechanical thrombectomy. A thrombus is a blood clot blocking an artery. Thrombectomy means removing that clot mechanically to restore blood flow. A tiny device like a stent is used to pull the clot out and restore blood flow instantly. This helps prevent permanent brain damage and improves recovery. Under live X-ray, a thin guide wire navigates through the arteries to the blocked brain vessel. A microcatheter then slides over it to reach the clot. Contrast dye confirms position before the device is deployed. A brain hemorrhage is bleeding in or around the brain when a vessel bursts, often from high blood pressure, head injury, a ruptured aneurysm, abnormal vessels, or blood-thinning medicines. Swelling raises pressure and can damage brain cells. After imaging confirms the problem, the team marks the incision, preps the scalp, and makes a small bone flap to safely reach the area under pressure. They gently open the dura, the brain's protective layer, to relieve pressure and begin evacuation. A simplified clot or hematoma is removed. Surgeons control swelling, place a soft drain if needed, and carefully check for any ongoing bleeding as the brain relaxes. Finally, the bone flap is replaced and fixed with tiny plates, the skin is closed, and monitoring begins in the ICU. The goal is simple: lower pressure, protect brain cells, and support recovery. After thrombectomy, your team watches closely. Vitals, frequent neurochecks, and blood pressure kept in target to protect the brain. Take antiplatelets on schedule. Keep the groin or wrist site clean and dry. Report new swelling or bleeding. Hydrate. Walk gently when cleared. Avoid heavy lifting. Call emergency services for new face droop, arm weakness, speech trouble, severe headache, or confusion. Keep follow-ups and imaging. They guide recovery. Keep the incision clean and dry. Follow your team's wound care steps. Walk daily as advised. Increase activity slowly, and avoid strain until cleared. Use pain medicine only as directed. Follow any anti-seizure or steroid taper exactly. Seek urgent care for fever, worsening headache, new weakness, confusion, seizures, or wound drainage. Therapies: physical, occupational, and speech help recovery. Return to work timing is personal. Your team will guide you. You're not alone. Subscribe to ICU Core for more educational and medical videos.